Back pain. 16 natural cures to unlock lasting relief. Does your back ache? Is it a constant, nagging pain that steals your joy? Stop suffering. You're not alone. Millions are trapped in the grip of relentless back pain. But what if I told you there's a way out? Natural cures, hidden in plain sight, unlock lasting relief. We'll share 16 powerful ways to ease your pain, naturally. Imagine a life without back pain. Let's start this journey together. Like, subscribe, and share, so others can find this relief too. Number 1. Gentle stretching. Easing muscle tension. Gentle stretching is a fundamental approach to easing muscle tension in the back. The knee to chest stretch, for example, is excellent for the lower back. Lie on your back, bend one knee, and gently pull it towards your chest, holding for 20-30 seconds. Feel the stretch in your lower back and repeat with the other leg. The cat-cow stretch, done on hands and knees, involves arching your back like a cat and then dropping your belly while lifting your head like a cow. This improves spinal flexibility and releases tension. Perform these stretches slowly and mindfully, focusing on your breath. Aim for several repetitions throughout the day, particularly in the morning and before bed. Number 2. Core strengthening exercises. Building stability. Strengthening your core muscles can provide significant support for your back and reduce pain. Try exercises like pelvic tilts, bird dog, and planks. Pelvic tilts involve lying on your back with knees bent and gently tilting your pelvis forward and backward, engaging your core muscles. The bird dog exercise involves getting on your hands and knees and extending one arm forward and the opposite leg backward, maintaining a straight line from hand to heel. Planks strengthen your entire core by holding a push-up position with forearms on the ground. Perform these exercises 2-3 times a week, gradually increasing repetitions and hold times. Strong core muscles provide stability and support for your spine, reducing back pain. Number 3. Heat therapy. Relaxing tight muscles. Heat therapy is effective for relaxing tight muscles and easing back pain. Apply warm compresses, take warm baths, or use a heating pad for 15-20 minutes at a time, several times a day. The warmth increases blood flow to the affected area, reducing muscle spasms and pain. Be cautious to avoid burns by using a towel between the heat source and your skin. Consider using a moist heating pad, as it provides deeper penetration of heat. Heat therapy is particularly beneficial for chronic back pain and muscle stiffness. Number 4. Cold therapy. Reducing inflammation. Cold therapy is ideal for reducing inflammation and numbing pain, especially after an injury. Apply ice packs wrapped in a thin cloth to the affected area for 10-15 minutes at a time, several times a day. Avoid direct skin contact with ice to prevent frostbite. Cold therapy is most effective for acute back pain or injuries. You can also alternate heat and cold therapy, using cold for the first 48 hours after an injury and then switching to heat. Number 5. Massage therapy. Relieving muscle soreness. Massage therapy can significantly alleviate muscle soreness and tension by increasing blood flow and releasing endorphins. Seek a qualified massage therapist specializing in back pain relief. Techniques like Swedish massage, deep tissue massage, and trigger point therapy can be beneficial. Regular massage sessions can improve flexibility, reduce muscle spasms, and promote relaxation. Consider scheduling a massage every 2-4 weeks for chronic back pain. Number 6. Epsom salt baths, soothing sore muscles. Epsom salt baths are a simple and effective way to soothe sore muscles. Add 2 cups of Epsom salts to warm bath water and soak for 15-20 minutes. The magnesium in Epsom salts helps relax muscles and reduce inflammation. Take Epsom salt baths several times a week, especially after physical activity or during flare-ups. Ensure the water is warm, not hot, to avoid skin irritation. Number 7. Turmeric. Natural anti-inflammatory. Turmeric contains curcumin, a powerful anti-inflammatory compound. Add turmeric to meals like curries, soups, and stir-fries. Mix turmeric with warm milk and honey for a soothing drink. You can also take turmeric supplements, but consult with a healthcare professional first. To enhance curcumin absorption, consume it with black pepper. Turmeric reduces inflammation and pain by inhibiting inflammatory enzymes. Number 8. Ginger. Easing pain and inflammation. Ginger has pain-relieving and anti-inflammatory properties. Drink ginger tea by steeping fresh ginger slices in hot water for 10-15 minutes. Add ginger to meals like stir-fries and soups. You can also apply ginger oil topically, diluted with a carrier oil. Ginger reduces inflammation and pain by inhibiting the production of inflammatory molecules like prostaglandins and leukotrienes. Number 9. Essential oils. Natural pain relief. Essential oils like lavender, peppermint, and eucalyptus can ease back pain. Dilute a few drops of essential oil with a carrier oil like coconut or almond oil and apply topically to painful areas. Lavender promotes relaxation, peppermint provides a cooling sensation, and eucalyptus reduces inflammation. You can also add a few drops of essential oils to a warm bath or use an essential oil diffuser. Number 10. Proper posture. Preventing back strain. Maintaining proper posture is crucial for preventing back strain. Keep your back straight, shoulders relaxed, and core engaged while sitting and standing. Use ergonomic chairs and supports to maintain proper spinal alignment. Avoid slouching and prolonged sitting. Take frequent breaks to stretch and move around. Proper posture distributes weight evenly, reducing stress on the spine. Number 11. Healthy diet. Reducing inflammation. Eat an anti-inflammatory diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids. Limit processed foods, sugars, and saturated fats, which can contribute to inflammation. Incorporate foods like berries, leafy greens, fatty fish, and nuts into your diet. A healthy diet supports overall health and reduces inflammation, contributing to back pain relief. Consider following a Mediterranean diet. Number 12. Weight management. Reducing spinal stress. Maintaining a healthy weight reduces stress on the spine. Excess weight strains back muscles and discs, leading to pain. Focus on a balanced diet and regular exercise to achieve and maintain a healthy weight. Losing even a small amount of weight can significantly reduce back pain. Consult with a healthcare professional or registered dietitian for personalized advice. Number 13. Hydration. Supporting spinal health. Drink plenty of water to keep spinal discs hydrated. Hydrated discs act as shock absorbers, supporting spinal health and flexibility. Aim for at least 8 glasses of water daily. Dehydration can lead to disc degeneration and increased back pain. Carry a water bottle with you and sip water throughout the day. Number 14. Sleep hygiene. Promoting muscle recovery. Get 7-8 hours of quality sleep nightly to promote muscle recovery and repair. A good mattress and pillow support spinal alignment and reduce back pain. Establish a regular sleep schedule, create a relaxing bedtime routine, and ensure a dark, quiet sleep environment. Avoid screen time before bed and create a comfortable sleep environment. Number 15. Acupuncture. Balancing energy flow. Acupuncture balances energy flow and reduces pain by stimulating specific points along meridians. Seek a qualified acupuncturist for regular sessions. Acupuncture releases endorphins, reduces muscle tension, and improves blood circulation. Regular sessions can provide long-term back pain relief. Discuss your symptoms and concerns with the acupuncturist. Number 16. Mindful movement. Reducing pain perception. Practice mindful movement techniques like Tai Chi, Pilates, or walking to reduce pain perception and improve flexibility. Focus on slow, controlled movements and deep breathing. Mindful movement increases body awareness, reduces stress, and improves posture, all contributing to back pain relief. Start with beginner classes or gentle walks and gradually progress. Bottom line. These 16 cures unlock lasting back pain relief. Try them daily. Consult your doctor for persistent pain. Natural options support health. Which tip helps you most? Comment below. Like, subscribe, share for more health tips. Feel better.